have in place a successful waste care. If you don't have this about the activity, the whole essence of the waste management plan in your facility will not be able to success. So please, go through this. Make sure you have it all lined out so that when we come to your facility, it will be easier for us to access these facilities. Now, after first healthcare awareness training, we try to exercise facility for healthcare waste, expected outcomes. Now, by the end of this session, participants should be able to correctly segregate healthcare waste management, then appropriately identify and deploy different methods for healthcare waste management and storage treatment. Now, after this training, we expect that each facility or each participant should be able to know how to segregate waste, and also the appropriate ways and method of how you use show you practically. In achieving the aims of reducing the health problems and eliminating potential risks to people who health just inevitably waste that may itself be hazardous to health and environment. The waste produced in terms of healthcare cultural, political, and socio-economic circumstances influence healthcare waste management as well as technical problems. Therefore, a well-designed legislative framework and plans for achieving local implementation are essential to change. Yes, this is a well-designed platform is expected. Now, we are opportunity to have Solina and FEMA. Because now you have so it will be good for you to sit down and understand this thing so that you'll be able to. If you have a particular person that is here, please, when you go back to your facility, gather all your staff, get a next person, transverse the training. You might not be there all the time. You might be maybe a better officer today. Tomorrow, God will promote you if you have another facility, or you might open on your facility. So if you don't transverse the training, that facility will be short. So now the plan that we have said, we are here to showcase all these processes, procedures, and methods. Now, the first session is what is the sample healthcare waste management? And everybody, please, we are here to understand this and then learn. So let's go over to while we do the training, and then we can also relate so that easier. Please all understand what healthcare is. But is there any person that would like to ask a question on this part? Healthcare is management, please. Please ask questions because they will help you. That's why you're here. We need questions. And anyway you can answer questions, I'll be able to look at your understanding of life. Okay. Now, what is the difference between biomedical and healthcare waste management? What are the types of waste? Definition of healthcare waste management. Healthcare waste management includes all waste segregation. Classification of healthcare waste management, infectious waste. The method will broad and other body example from the standard diagnostic sample, from laboratory work, e.g., waste from autopsies, infected animals from laboratories, or waste from patients who be infected with infections. Waste. Chemical transformants are originally used for laboratory preparation, disinfectant, sterile, and heavy medical devices. For example, making the broken thermometers and batteries. Pathological waste. So, sorry, now, this battery is even your phone, when you are using it in the facility, it can become corrosive. So you have to be careful with your phone or using anything that has battery. Contaminated animal species, sharp waste, sweet, needles, disposable, stapling and blades, static waste, waste containing substances, genetic properties, example, hazardous substances that are mutated, terminally or carcinogenic, such as psychoactive drugs used in cancer treatment and their waste that does not possess any biological, radioactive, or physical hazard. Now, pharmaceutical waste, expired drugs, contaminated drugs, and vaccines. Those are pharmaceutical waste. Now, this is healthcare. I would like to proceed if you don't mind, but I will take you this time around. Now, we have this healthcare waste. This matter is outside the self-inflicted injury and cases. Please, can you add up this slide? Now, this is the health enforcement. In particular antibiotic and cytotoxic drugs, releasing into surrounding environment and substances such as mercury and oxygen, respiration or health waste. Now, with the handle of this waste, there might be speed or leakage of all these kind of toxins that we talk about, this cytotoxic drugs. Some drugs are necessary and they are very, very contagious. So in handling them, if you're not being careful, they might spill or possibly they might contact into the environment and then can cause harm and injury to the public. Then we go to chemical in the context of disinfection, sterilization, or waste treatment activities. Now, sometimes when you are doing some disinfection in the facility, some of these chemicals are very hard, they are hazardous, they have harsh, the odor is very harsh. And you have patients in the hospital, in the world, and your cleaners don't know how to apply this. If they now use it in raw form, it will definitely affect that just also feeling unfit. Each of the samples kind of chemicals have ways of and then stuff. available within the facility, even the large. Now we get this waste management, waste products, and you want them in your facility. Now, number one, the person wanting is at risk. The patients in the facility, they are at risk. The environment, people within the environment, they are at risk. And fourthly, the environment itself is at risk. Because the ratio of that money will definitely affect the people that will come next year. So in an instance whereby you take this waste, you want them in the facility, and if you as a doctor are not there while I'm running this thing, but you want to interact with the patient, you're still going to interact with the same cleaners, and that same people again will still come and pass over to you and send over. Now go to additional points. Now go to person activities that happen when you have reactive materials. And those reactive materials are very, very dangerous. Once we get if you're not careful, when you throw them under a very high temperature, they can boil. This sort of people are the first people that are really risk. Let's say, for instance, you are a doctor, right? On my field, not in the hospital. But then, let's say in your hospital, I'm a doctor. Then I go to work in the morning, and my cleaner has done all the necessary cleaning. I've done everything from my office. The next thing I want you is, please, make tea for me. The person who's going to make tea for me is maybe an auxiliary or a cleaner. Now, in that sense, what if the cleaner has gone to have interaction with somebody who is infected with maybe like hepatitis or AIDS? Let's say hepatitis. That person has gone to maybe clean up the room or facilities where you have patients like that, and it's coming to make it. There is a cross contamination, and which is not good. So please, from the beginning, we have to start from our staffs, because it's from the staff that gets back to us. Now, if a patient comes to a facility for observation, the staff, the junior staff will first see them before it gets to the doctor. Even if the doctor is not there, the staff will see what the nurse will say. Now, those people are prone to this problem, so please take note of this. Then patients, in healthcare facilities or receiving home care, that's what you're missing. Now, sometimes you don't even know someone is coming to a facility for medical care. And before, what we normally do in Nigeria is we have OPD. Everybody is there. First we carry Izu, first we carry Izu, first we carry Washoko, first we carry is there. Now, somebody and he comes to that person and sees the doctor. Now, before seeing the doctor, some of us, our nerves are strong, but some of us, our nerves are weak. So what happened? The first set of people that and people that this can affect. Then visitors to healthcare facilities. Yes, sometimes visitors come to facilities. You know we have healthcare, hospital acquired disease. Do you know that? I'm very healthy, maybe my wife is in labor, I come to hospital, I go to the institution, I pay all my bills, then I go back to the hospital to work, I see my wife, I'm happy. The next thing, I fall in. What happened? facility I have come to has been infected one way or other, one activity that is not giving me. So you see, there's a lot of challenges and the processes that we go through. Now, people that have come to us are those services. Now, don't mind me as if you is providing the service. What happens to you? Let's be honest. All of us are in the service. One way or another have a limit. Let's see ourselves. All of us that we go to work with facilities, we have one or other element. If you don't get fall, you don't fall sick. You have running nose. Even if you don't fall sick, you always have headache. You see, this all the scenario is good. What about your waste management site? If that site is not good, what will happen? Your facility is ready, your work is clean, your dustbin inside a car, well lined up, all covered. Then what happens to the dump site? Go to the dump site, you see that place is clean. So what happened? The flies that goes around the environment goes to the dump site and comes to the hospital again. Works in landings and waters. Like I said, all staff are all prone to all this risk. They are working in waste management facilities such as landfills, treatment plant, and informal recyclers. You see, most of these waste that we generate from our facilities, we don't properly dispose them. What happens? They go back to the hands of individuals that do not even know where they come from. Let's say, for instance, now switch. You see, we use switch are being used to put an oil for all this keke. Now that kind of switch, he doesn't know where it's coming from. You're buying the oil again for your machine. What happens? The machine has gone all over from the hospital straight to the environment, then back to the hospital again. So you see, the people, all these are being at, and we need to safeguard these by putting in place a proper waste management plan or facility that will take this process is very easy. By kg, by ton. Now from kg ton, and kilo per ton, we will come and collect what is that way. But you need to minimize the waste you generate. And how do you do that minimization? It's through segregating. You segregate. Like my colleague next slide will show you how to properly segregate. You have the bins. Everything is brought from one place. By the time I will weigh it to be 200 kg. Well, I will take 200 kg times 1.5 and I will go away. You must. But then you need to understand the processes by segregating so that you minimize. Now collecting from the source. That's the first place where you collect. Now, facility, it could be inside the work, it could be from the theater, it could be the consulting room, even from the restaurant. So each place you need to have a smaller bin that are well colored so that your workers outside this. Those workers that are inside have been trained to handle this. Off-site transportation. And off-site transportation is the vendors will come to our facility and collect way first. The way what you have, then they collect. The vendor will take it to the site or to the related area where they are going to be treated. Now we're going to start it. The advice that we all the international standard for storage of agricultural waste. The maximum is 72 hours. People agree you keep to that 72 hours. But 72 hours is the maximum hours. But we expect that facility. But within the inside facility, you don't keep waste more than 6 hours. Within your facility, on site, you don't keep, within the world, you don't keep more than 6 hours. After that, when it's supposed to be airtight, with the bin line, quite the bin line, tight it up, and take it back to the waste area. Because at times, they keep and you may not know that they punch or the speed falls hard. And you know, whatever you have in this country, you will always have flags. You will always have flags. So if you don't close and the flag are coming, work on it, then what happens to you? If you must work on the death, I will come and buy it, what happened? Sometimes the hospital in the hospital does not give you malaria. It gives you other diseases, not as a patient from other substances. So please don't waste in facility more than 72 hours. Now, taking to the facility, and taking to the waste upside, the collector comes to collect it, takes it to the treatment facility. Now, for the treatment facility, we always say that when they bring, you feed instantly. You don't keep. It's only when you have some of these sharp, some of these that you keep to segregate, but then you don't keep any chemical waste for more than 12 hours in your site. No matter how good the site is, even if you have time, you don't keep them more than that hours. They want to dispose of them. Types of disposal we have, we can destroy, we can sterilize, them landfill, or very although in the because you cannot take it to the landfill what is properly treated. Because contaminated environment can go back to the facility. The video I the site, I saw one of the facilities sent out their waste and gone to that area by 16 evening in morning. What happened? You are in the facility already, and the waste company that comes to take your waste, you don't even know they are, because they are not licensed, they are not registered. They come, you are but you are or had a and it's now distributing and distributing those things. We pray that to our future. So disposing, these are the few regulations of disposing that I'm just talking about. But presently there was proper treatment by isolating those waste now. Now let's have restoration. So that we can understand. Because I don't want us to be speaking too much English. Too much English we can understand. But practical aspects will be national law. So waste management practice must meet national law requirements. There is national requirement and there is national requirement. So waste management has to meet all of this requirement. For us to our discussion. We'll come back to this now. Or I think I'll just use the opportunity. Please pay attention to this part. Because this is easy. Try to understand this very well. Because this is where this is kg, what is kg? We all know what kg, what is kg. So we should know. Our personal collection because I think you don't need to go down to too much information. Collection from the source to the site, then the vendors will come and collect. Before I mentioned 1% fresh sodium hypochlorite for production powder, solution as for particle waste guideline. This particular disinfection that we just talked about is for every waste management you are doing, you must be able to disinfect yourself. Disinfect yourself, the facility, and the waste system. All those guys that say come and take the shop to your facility will not have the chance of waiting. So please always have this facility within your facility. Okay, now we know that is very expensive, only few us to have a chocolate. But people that have the smaller ones, we know how to use the chocolate. It's a form of disinfecting our shafts that we use for operations. Now, let's say our management workshop agenda. This is where we're here. Practical session. And our agenda, with the permission of the agenda, come and to practical session so that before our brains are, we're able to stimulate and then continue with this. Thank you very much, and thank you for coming and thank you for your time.
For Madam Sani before we go to our practical session. Any question?
Please ask questions.
Please.
I have questions for you. I have plenty of questions for you. I have plenty of questions.
Okay. So we'll hand over to
if you don't ask our questions, we'll not facility. Because that shows that you don't even want to come.
Thank you very much for that statement.
Okay. Salina, can you please, as those slides, you still have them? Those facility videos, please. I will continue before you get them. Bismillah. Now then, what you want. Ladies and gentlemen, it is very important for us to concentrate and pay attention to this very important stage of the training. If you get it right at this point, you don't have any issue of cross-contamination. I will start by thermophiles can only be manipulated at temperatures above 1,000 degrees Celsius. What you have at your facility, you may only attain probably between 100 and 120. we have made slight adjustment here. Because if we want to give you everything, we're going to have about 5 different boxes. The shares are collected in boxes. But it's not realistic. Because the boxes it's not uniform, we are workers. We now notice at the end of the day. All pathological waste. You store maybe placenta, blood gas, giving cells, all those that has relation what any kind of pathological waste you want to use in the system. Now, have one is you put everything the day you now tag it down here. Because no matter how much you try to do what is the system plan, we will not have an idea. We are going to have organized for all the areas of the hospitals. We will take you to where we choose the waste proper. You see the machines we use, and this KG naira issue, I believe by the time you finish the tour, even you yourself will say, I can't go there, because you sure you understand how we are saving a lot of money in that center. The collection and transportation takes 50% of the budget. 70% of the budget is spent where? At the treatment plants. We have different machines. One machine, after collecting the bottles, you use a machine to wash the bottles into powder food. You disinfect, and then you add and take it back to last and second industries. The pathological, we subject them for incineration at above 100 degrees centigrade. Sorry, 1000 degrees centigrade. Maybe you say boiling water times 10 of just heat. You cannot achieve that easily unless you use machines that are highly technical. And that's what exactly we have at our training facility. At the end of it all psychophilic, eosinophilic, and thermophilic bacteria and other microorganisms are expected to what? Thermally decompose, thermal decomposition is the decomposed thermal. And the fly ash, there's what we call fly ash, either as it goes out as a smoke, is trapped in the chimney, and the chimney has a filtration system where all the dihydrogens are trapped within the silencer of the chimney, and only smoke, harmless smoke that goes out from the chimney. It's a system. Now, the combination technology within the incinerator also make sure that that temperature is achieved for a certain period of time, in which the ash we collect is harmless. We can use it with other things. But what we normally do is we do what we call sensory learning, like Alexis said. But now, because of technologies and advances, that same ash, after you subject it to further treatment, like the use of UV light, ultraviolet radiation, at the end of the day, you can use it to color your pavements. What them interlocking attires pavement and use it. Because at the end of the day, you try this, you test it. And I don't get anything to use it other issues, other purposes. Now, the challenge of that is that many purposes as I speak now, they are very low services first approval. Only like 20% of the purposes that are in this fire project are paid this maintenance. So I believe the challenge and come up with a program that any hospital that cannot buy upfront, if you cannot buy upfront because they're expensive, when we now compare their utility, it's also expensive because we use it for 5 to 10 years. When we now divide the money by the period, you see it's not too expensive. So those that cannot have upfront payment, we can break everything into 14 installments. Provide that we will let out as a program in October. So those who are interested can contact us for that review segregated campaign. So that by the time you start by October 5, all 50 hospitals that are in the pilot will be lagging behind and start together at once. So I believe this is theoretical. If you have any questions, whether it's myself, feel free to ask us. Because I want to go over the ground of the what they are assessing. All those areas we ask you to delegate as collection point, we cannot be going to different words to ourselves outside the collection. Our aim will only right finding, go to a collection point, pick everything, and transfer it back out as an institution. So if you have issues, please let us know now. If you want us to give you training because of the time, let us know so we can discuss. If we can start by our first technical issues that think this is so thank you so much. We take your questions. Thank you.
Thank you very much. So,
When we were that part, we decided that I learned to be gracious. Gracious, I do. Yeah, as well as the president of the